there's another example that I just saw, and these funny examples are all over the place, but somebody, I don't even know why, asked about gun safety around cats. So who knows where that came from? But the AI replied that cats can accidentally knock a loaded gun off of the table and cause a discharge. So it's very important to talk to cats about gun safety. So you can almost follow the trail and then it takes a total left, you know? So
Yeah.
I could see logical fallacies that really get in the way, especially in an emergency situation when
Mm.
emotions are heightened and people may not be thinking fully clearly to begin with.
Welcome to the Good.Enough.Shrink podcast. We are your hosts. I am Jenna Chang, a child, adolescent, and adult psychiatrist practicing here in Los Angeles, California.
And I'm Dr. Patrick Kelly. I am also a child, adolescent, and adult psychiatrist practicing in the Los Angeles area.
We are on a mission to demystify child psychiatry and have conversations surrounding difficult topics on youth and adult mental health, but not without a little play along the way. Welcome to the podcast. Today we have a very exciting and a little bit nerve-wracking, actually, topic of artificial intelligence and mental health. And so, Dr. Kelly, I just want to open up first and ask you, how do you feel about this topic overall?
I think artificial intelligence is really interesting. It's very cool. All the tricks it can do are fantastic. I think it's also misunderstood because intelligence is in the name, but it's not truly intelligent. It's not actually thinking. So I think that like everything else, it needs to be taken with a grain of salt.
Yeah, I just listened to a podcast by Esther Perel, who's the famous couples therapist, and she called it artificial intimacy, referring to how it's almost like a compensatory mechanism to create intimacy in an artificial way in a world where we're not really connecting as much. And we're not super skilled at it yet, although I think there's potential for skillful connection through AI. But as we always start with a little bit of background information to set the stage. So as I was reading through, there was this kind of idea that we're at this fourth industrial age after mechanical, electrical, and the internet. And now we're at what they call digital revolution, which I think the word revolution is probably very appropriate because it's like an entire restructuring of everything we know in terms of information, sharing, everything. So really the idea of AI started back in the 1950s when Alan Turing, who is considered the father of AI, came up with this idea of the Turing machine, which is the basis of a computer. He proposed that there can be a computational model that manipulates symbols on a strip of tape according to a set of rules. And this is essentially the modern computer in a very, very sort of primitive description. But what really caught me when I was reading about the Turing machine is this idea that this tape that follows a set of rules, this tape itself is infinite, can be infinite. And when something is infinite, by definition, it kind of feels out of control.
Mhm.
There isn't like boundaries around it. It's a similar feeling that I get with AI is that, there's a certain level of losing that control that I think it makes us a little bit fearful of what it can do. But so we, obviously a little bit more focused on AI's role in healthcare and medicine. And currently, there is a lot of uses in medicine for disease detection, optimizing medication dosages, and rapid analysis of large data. Most successfully, these are operated in ophthalmology, oncology, dermatology, and radiology, which makes a lot of sense. I think if you are in the medical field, we can see how it's a lot more sort of black and white in the way, okay, this is a positive finding, this is a negative finding in these subspecialties. Not so much in psychiatry. We'll get to that. But yeah, it really is able to detect subtle abnormalities missed by the human eye. Just the speed at which it can synthesize information is extremely helpful.
And it has some advantages because it can see the numbers. So radiology, X-rays, so it's a film with various shades of grays or translucency, and you can apply different filters. But the job of the radiologist is to try to look for those subtle differences, really by judging the scale of gray. But the computer knows the numbers behind that visual representation. So it can tell if, the shade of gray is 1/1000th of a percentage different than the shade of gray next to it. And so it can be much more accurate at teasing apart those subtle differences that it's harder to see. So there really are advantages that
Hmm.
that things like AI or large computational models can bring to those sorts of subtle distinguishing features. But
Hmm.
yeah, psychiatry
Yeah.
is very different.
Very much so. So, the global AI in healthcare estimated growth in terms of the money that's involved in AI. So, this was like absolutely mind blowing. It was right around $5 billion in 2020, and they predicted that by 2026 it would be up to $45 billion, which is in 2 years.
Yeah.
So, we have essentially grown 9 times in 6 years. But probably this is an underestimation because, it's exponential, this growth, this market here. So there's a lot of people who are going to want to do business, the
Hmm.
private sector. There's going to be a lot of ethical considerations that will likely involve the government. And then there's also people like us who are trying to prioritize safety and what's really important coming from a very clinical perspective, of course.
No, I think it's both very exciting as a potential and an opportunity. And my worry is the same worry I have about a lot of things, that people go too fast to adopt new things without considering possibly unintended consequences or what might be lost in the transition. I also think there's different frameworks to look at this, because we as psychiatrists, we're talking about the application to patient care, and how AI might be able to help us with diagnosis or formulation or treatment plan. I think there's also the idea of taking some of the repetitive burden out of medical practice in general. And so that might apply to psychiatry, that might apply to any medical field, to help with notes, to help with billing, to help sort of the back end, so
Mhm.
that we have more time to do what maybe it will turn out we're much better at, which is diagnosis and treatment planning and all of
Mm.
those things, and spending time with patients. And then there's also the application for almost kind of the independent use of AI by patients, where psychiatrists aren't even involved, to get feedback for something like cognitive behavior therapy, something that is by definition uh, routine and standardized. And maybe there's an opportunity there where the patient would never even meet with or see a psychiatrist or a therapist, and there might be more independence there. So there are so many facets and aspects to think about that
Mhm.
it's
Yeah.
overwhelming.
Yeah. And that's a great segue into talking more about the benefits. Yeah, and like you said, Dr. Kelly, I think administrative help for the psychiatrist, it would be wonderful. I think I spent many hours just documenting and making sure that the loose ends are tied there as a psychiatrist. And writing notes, it is really, really important because it's kind of the main objective data that we have in psychiatry. And I think there's an art to it. But it takes a lot of time, and it would be really,
Mhm.
really helpful to have AI support that. And then also, as you said, certain therapy modalities like CBT, ERP, exposure response therapy as well for OCD. And then DBT, of course, is dialectical behavioral therapy for emotion regulation and stress tolerance and things like that. I think if it's very much based on skill building, it can be really excellent. And also, if it's based on a lot of psychoeducation, if you're kind of new to mental health or you're trying to learn what are the definitions of things, what are the biological underpinnings, it's really, I think, helpful. But it does make me think that you kind of have to be ready for that.
Mhm.
Like you have to be in a mindset where you want to feel better mentally, emotionally, you're willing to put in the work and the time because it is a lot of effort. If it is presented in a sort of unskilled way by AI, certain informations can be harmful. Actually, I was watching this 60-minute special on AI that was published recently, and there is like a chat bot for people with eating disorders created called Tessa.
Hmm.
And, there are some critiques about it. But one of the things was that, as they're interacting with this chatbot, the chatbot suggested lowering calorie intake.
Hmm.
But there's a whole process through that. It's a very, very sensitive topic and has to be very, very nuanced. And so it doesn't replace human interaction, human intuition, but it can certainly be supplemental and helpful in other ways.
I think that's one of the almost not purposefully but deceitful things about AI is that anyone who's used one of these apps, it sounds very intelligent and it feels like it's really responding and really processing and thinking. But really, the way it works is by statistical analysis. It takes large amounts of data and conversations and looks at them and really looks at the most likely next step and statements and phrases. And, honestly, a lot of the training of these models where it's looked at data is the internet. It's not medical journals, it's Reddit. So a lot of
Mhm.
the knowledge base is not necessarily based in science in the same way that speaking with a psychiatrist or a therapist is. We can put things into a different context.
Yes.
um, and there's even in something like CBT, which is so manualized and sort of routine and standardized, studies have shown that people who have more experience with CBT and are able to adapt to the patient in front of them and dodge and weave a little bit around what's going on as opposed to just in lockstep go through the lessons, the patients do much better and have better results. And so I think that algorithm that has such strict guidelines might have difficulty with that,
Mhm.
might struggle with going around. And my favorite thing about artificial intelligence is that it hallucinates, which I love that term. And so they talk in research about hallucinations, which are statements made by AI that sound very factual and very true, but are completely fabricated. So people have done all sorts of different experiments with this, but in an older study, they were looking at cancer treatment advice that artificial intelligence could generate.
Mm.
And even oncologists who were reading over the advice got a little tripped up because it seems rational and logical. But when
Mm.
they actually look in depth at the advice versus the patient, it's wrong. It's completely incorrect, even though it sounds very true. So it's weirdly convincing, even about false statements.
Hmm. Yeah, what a word choice.
Hmm.
Hallucination. But yeah, that kind of captures it. You take the emotion out of it and you sound absolutely confident, and it's completely wrong.
Hmm.
Actually, that makes me think about the liability aspect of it. So, we are licensed and we are very thoroughly monitored, making sure that we're staying ethical and up to standards. But AI doesn't have that. And so,
Hmm.
if you are dabbling into healthcare, do you have to consider what you can be liable for? If someone hurts themselves because of some of the things that AI might have said, it's just a whole can of worms.
And there's
Yeah.
also privacy in addition to the practical concerns of what somebody does with the information. But, there are AI models that are very explicit about the fact that this data is not used anywhere else. We don't take this to continue to train the model. This is one time. So you can put more
Mhm.
information about the patient you're treating, which is necessary. The more information you give a model, the better it can give you advice and give you talk back. But not every AI is like this, and they don't have to tell you what they do with their data. So
Mhm.
there's a little bit of buyer beware. And so somebody could be spilling all of their extremely private personal information, or their doctor could be doing that unknowingly into the ether that is actually being used to train the model in the future. So your information is being sort of immortalized in AI forever. So I'm not trying to sound scary about it, but I think it's worth considering how important that is to you.
Yes. Absolutely. I think it's like the CBT dialectic thing where we really have to balance the pros and cons and really think of everything, especially because, this stuff is reaching adolescents, children. It goes straight to their dopamine system. It's really fascinating. It's interesting. It's instant gratification, that kind of thing. And there are these apps and platforms where you can pretend you're talking to a celebrity. There's these deep fake models of celebrities, or you kind of imagine that this person is real, but they're really not. It makes me wonder about what it does psychologically, the impact on the developing brain. Also, I really value not having any information passing through my head for like an extended period of time, just sitting with my thoughts, or maybe just feeling a little bored, maybe just trying something with my hands and working through something not in the 2D digital world, but in this 3D world that I live in. But the value of that is also taken away. And so how does AI affect children, teens, education, development? What would happen to this inability to tolerate that sort of uncertainty? Because a lot of answers you can access very, very quickly. And where do you draw the line? How do you teach a child about the line of consciousness? I think that's like a bigger, much bigger question. But I can't imagine being born into a world where the line between consciousness and human consciousness versus AI is kind of blurred. And, maybe you develop a relationship with an AI nanny. I don't know. But how does that change their understanding of the world?
No, that's very true. And I don't know how in 50 years we're going to look back at that. I don't know if it's going to be something that truly develops into a problem where the line between fantasy and reality gets more blurred, and even incorrect information is sort of magnified and reinforced, and people have difficulty relating to other humans because they actually do think and have their own feelings and relate in a different way than an artificial intelligence might.
Hmm.
Or if it's like the old argument against televisions that it's going to confuse kids and they won't know what reality is, and they're going to have trouble relating to real food because they won't be able to determine the difference between that and a picture of food. So I don't know how humans will adapt and neurobiology will adapt to that. But it's a fascinating question.
Yeah. And another question that came up in my mind was AI in the emergency situations for mental
Mhm.
health. That I do think it can be potentially very, very helpful, especially if you are just feeling absolutely alone and you can't really get help in that instant. Having some sort of response from something is helpful, but there's also potentially harmful effects, like, tell you something that minimizes your symptoms, that makes you feel small, invalidates.
I think artificial intelligence definitely has strengths. It's a fantastic wordsmith. It can really help with vocabulary, it can help with explanations of things. But in terms of actual factual reference, I think it can make missteps. So there's another example that I just saw, and these funny examples are all over the place. But somebody, I don't even know why, asked about gun safety around cats. So who knows where that came from? But the AI replied that cats can accidentally knock a loaded gun off of the table and cause a discharge. So it's very important to talk to cats about gun safety. So you can almost follow the trail and then it takes a total left, you know? So
Yeah.
I could see logical fallacies that really get in the way, especially in an emergency situation when
Mm,
emotions are heightened and people may not be thinking fully clearly to begin with. So I could think of a number of very scary examples
hmm.
where the advice is just either completely wrong or logical but absurd in a
Hmm.
way.
Hmm.
But I think in the hands of an emergency psychiatrist or an emergency room physician, it could be very helpful in
Mhm.
creating safety plans that are very closely tailored to a patient, as long as it's double checked, or in discussing various resources that, because it does have access to the internet, some of them do, that the psychiatrist may not be aware of or privy to. So I think it has uses in a controlled context.
Mhm. Yeah, that reminds me of this concept of jailbreaking, where users will trick the AI into behaving badly. And I was reading about a certain jailbreak called DAN, which stands for Do Anything Now. So essentially, a lot of them are programmed to not answer like really violent questions or really, questions that have to do with like self-harm, racism, sexism, and things like that. But these jailbreakers or users will trick these AIs to override that, which can be harmful. And so yeah, these are the things that we have to be really aware of. What's really interesting to me also is that there's artificial intelligence based on a set of rules and like that data gathering, and it's kind of more based on what's already there. And then there's a different kind of AI that is more generative, and I think they call it generative AI, where they actually hypothesize and come up with new ideas based on a set of data. And that is also endless. The
Mhm.
possibilities, just a little bit of difference in the way that you present an idea, it can change the whole tone of whatever they're trying to generate. And so this is why it feels very nerve-wracking to me. It's very, very exciting. I think it has a lot of potential, but it makes me more nervous than anything.
And I
Yeah.
think that's shared by a lot of people, that there's a mixture of excitement and nervousness, especially when we're talking about kids and children who may not have the understanding to be able to say, well, even though this sounds correct, that's not correct. Or to switch the subtle way that they ask a question so that they get a completely different result closer to what they were expecting in the first place. So, sort of a confirmation bias of whatever they ask to begin with.
Mm-hmm.
Um, and I know, well, I don't know for a fact, and I hope that the AI companies are taking all of these concerns into account in the way they're generating their models and thinking about the future. I know that the government is certainly involved in that, both in the United States and the European Union. So it interestingly makes me feel relieved that everybody's nervous about it, because I think people are taking it seriously.
Yeah, I would hope that there are people who represent clinicians or teachers or parents, people, that work directly with children and adolescents at the table discussing these big changes to these companies, whether it's OpenAI or Microsoft or whatever it is, that can really change the course of humanity as a whole. I would hope that they bring people like that to the table, because a researcher has a lot of information, is extremely helpful and on the side of acquiring more knowledge and advancing technology. But at the same time, all of that takes years and years and years. And there are things happening right now that are harming kids, teens, and young adults. So, yeah, I would hope people really do keep this in mind. It's really different from like the television age. I feel like for TV, there was all kinds of ratings, all kinds of editing, lots of filters to go through before it gets published. But the internet is just click two things and then you can publish. And so it's a really, really important thing to have some level of accountability as a society.
It reminds me of the discussion we had about social media, that there's this tension between things developing so quickly and wanting to access that and wanting to make that available, and the sort of natural sense of caution that we
Hmm.
that we might have about it, and trying to be more careful about what's actually put out there.
Hmm.
The classic idea of science, of research, I think it's 18 or 20 years from the inception of an idea to the actual application. And, I don't remember the first time I heard about AI, but it was definitely within the last few years. This is not a well tread established protocol in any way. And we're sort of all figuring this out as we go. And I think one of the scary and exciting things is that to an extent, AI can improve itself and can teach itself. And if you just let it go, it can continue to learn and improve and iterate. And so there's almost a sense that it's speeding away by itself, maybe in a way that social media wasn't, that makes me even more interested about what the companies are doing to keep it reined in and what the government's doing to keep it reined in.
Yeah, I do wonder if artificial intelligence in some way can bring people together. I think that's something, especially with the current events and everything going on in the news. A lot of people are hurting in so many ways. It's very polarized. And there's something about artificial intelligence that it might bring us together because it elicits similar kind of fear, excitement, interest, curiosity that can be neutral and universal. And so, would you think that there is potential to unite people a little bit more, give more room for conversation, open mindedness, and things like that?
I would hope so. I would think that there might need to be some sort of guidance along those lines because I think it might also go the other way. If I believe that the sky is red, it's a firm belief that I have. I'm sure I can ask AI a series of questions about it that would come out
Mhm.
reaffirming my belief in some way. Because of the way I ask the questions, I can change how it answers. I don't think it's totally objective in that way. And so one of my worries is that it would increase the echo chamber effect. That if I had very strong political, economic, social beliefs, I could find a way to get the AI to reaffirm those beliefs.
Mm.
My
Yeah.
hope, though, is that the strength of AI and the power is that it is unemotional in that way, that it can have an emotional tone, but it can be very balanced and it can be very rounded in its approach to different questions. And so might actually be extremely skilled in a way that humans are not at negotiating, at bringing people together, at finding commonalities between viewpoints and at bridging those gaps. So I think there's a tremendous opportunity if it's tilted in the right direction, but I worry that it could also go the other way.
Hmm. Yeah, I think there is value to when things are very polarized, there's emotions attached to it. And for the people who might be like right on the border, or maybe if it's convincing enough where if you read it and it makes sense, it might just snap you out of that state, that sort of neutral source of information, and even maybe hypothesizing things from a very logical standpoint can sway someone to be more inclusive. I guess that leads me to another question, which is because AI doesn't have this emotional component, do you think that in certain therapy modalities like psychodynamic work or attachment work, how do you think that AI would participate in that kind of therapy if they were to try?
I think that's tough because I do think that there is something that happens in the room with a patient. There's the transference, there's the countertransference, there's all of those dynamics that come up that are so important to uncovering what's actually happening and interpreting what's actually happening. My guess would be that AI could be helpful at case formulation or alternative ways of looking at a case. You know, if someone's a Freudian psychoanalyst versus a Jungian psychoanalyst versus a Kleinian psychoanalyst, it would probably be able to very accurately and succinctly pull apart a case in different frames like that and possibly suggest treatments. But I just don't think that in the moment it would be able to respond or reply in the same way that a therapist would be able to, because so much happens so quickly. I was just seeing someone the other day who was saying, I thought about canceling today. I don't really feel like I have that much to talk about. And it was an extremely productive session. We actually got to a lot more because we weren't as stuck in crisis. We were able to uncover some of the deeper things. And I could definitely see If someone logged into a session and say that, AI would say, "Well, good. Like, keep feeling great. I'll see you next week." I just, you know, I
Mhm.
think there's a skill set and an intuition that
Mhm.
you can't really put into words, but you can't undervalue.
Yeah, no, it's very, very true. I think what's in the room is it's so important in our line of work. And sometimes silence is so powerful. Sometimes we just feel horrible together about the situation. And sometimes we celebrate together. And that sort of mirroring, as we talk about in attachment, is incredibly healing. It's not something that you can really put easily into words. I think a lot of it, you have to experience it. And once you experience it, it's like there's no going back. I think that if artificial intelligence is somehow able to capture that, like if it can make people feel really, really understood, that can be really life changing. It reminds me of the movie Her, which came out like years and years ago. But, it's about this man who falls in love with this artificial intelligence. And it's very, very complicated. But again, goes back to blurring the line between what is consciousness. Are we playing God here? What are we really doing?
And I haven't, for full transparency, I haven't seen that movie. I'm
Mm.
even more interested now with the accusation that Scarlett Johansson's voice is being used to mimic her now that those capacities are closer to existing. But I think my presumption is part of the strong message of that movie is that it's an artificial connection with an artificial intelligence, that it's not a real human connection. And I do appreciate that and value that. And I think that's an extremely important prospect, that part of having a real relationship with someone is that the other person has their own feelings and thoughts and emotions, and that challenging each other in a way is how people grow. If you surround yourself with artificial companions, I don't think that would inspire growth in the same way as relating to other people and other humans. And that's a very dry way to see it, but I think that is at least one thought or consequence of that.
Hmm. Yeah. So this episode is very much more talking through conceptual framework because we really don't have a lot of data on this. It's difficult to do research on something that's so new. And also, it is really hard when psychiatry as a field, psychology as a field, we don't actually know what is really happening in the brain for depression, exactly what is happening. We don't know etiology of bipolar disorder or schizophrenia. We have a lot of evidence to suggest multifactorial causes, but there's not really clear cut understanding of all of these psychiatric disorders. So then to base our AI algorithms models on something that's already very unclear, it's hard to begin with. And so there's a lot of questions and uncertainties, but maybe this is exactly the test that we're supposed to overcome, that we are supposed to be okay with this uncertainty, unpredictability. And that's the point of AI coming in and integrating into our world.
That's a beautiful way to see it. That's a wonderful perspective. I am also reassured that, like I said, we're not the only ones thinking about this and worrying about this. So, the American Psychiatric Association has a committee that is looking into and thinking about AI and its applications in mental health. The American Academy of Child and Adolescent Psychiatry has a work group that is meeting about this. They will shortly have what's called a Facts for Families, a fact sheet about artificial intelligence, both for practitioners and for families. That should be coming out in the next few months. And the American Academy of Pediatrics has a full section of their website on artificial intelligence in pediatric care for pediatricians. And they have a companion website called healthychildren.org that has a number of resources about artificial intelligence in kids for parents. So we're all
Mhm.
trying to keep up, I think, with the development of this technology while also, how do I say this? We're all trying to stay on top of the development of this technology and make sure that it's used as much as possible for the betterment of ourselves, for the betterment of patients, and that we understand it without having that sort of theoretical, scientific, evidence-based background that we're so used to working in. So
Mhm.
we're sort of tap dancing to stay up on this technology that's changing as we speak.
Yeah, so on point. And I think taking this from the perspective of parents, it's so challenging to have to answer questions that your kids might have about AI that nobody knows about. I mean, it's kind of the theme here for young parents. I think with COVID and social media, AI, it's just really unknown. And so hopefully the message we can send is that we are talking about it, we're thinking about it, and we would love your questions and to let's keep talking about it.
And we will say for clarity that no AI was used in the writing or production of this episode.
None
But
at all.
yep.